Hi friends, welcome to Nursing Jellyfish. Today let's see the RRB Nursing Superintendent question paper. It is very important for you. First question, a nurse is caring for a client with a history of alcohol use disorder who is undergoing detoxifications. Which of the following assessment area priority for the client? So என்ன வந்து மெயினாக வந்து how to assess neurological status, vital signs, diet intake, skin integrity, which is very important for you it is. Yeah, that is a correct answer is answer B, that is vital signs. Second question, a nurse is teaching a client about the side effect of new medications. The client report having difficulty swallowing pills. Which of the following options should the nurse recommend? Option A, crush the pills before taking them. Ask the powder for a liquid formulation. Option C, skip the medication until can be swallowed while. Take the pills with a small amount of water. What could be the correct answer? Actually என்னன்னா நம்மளால swallow பண்ண முடியும் அப்படின்னா என்ன பண்ணலாம் நம்ம liquid formula கொடுக்கலாம். So that is why the option B will be the correct answer. Third question, your nurse is monitoring a client who has been prescribed warfarin. Which laboratory the nurse should closely monitor? Option A, platelet count. Option B, activate partial thromboplastin time. Option C, prothrombin time and international normalized ratio. Option D, hemoglobin and hematocrit. What could be that main medications it is? That is, it is an antiplatelet drug. So what you have to prescribe, that is a warfarin. So that is why option C will be the correct answer for that. Fourth question, a nurse is caring for a client with a diagnosis of heart failure. Which of the following nurse should include the client care plan it is? So option A, limit fluid intake as prescribed. Option B, encourage daily weight monitoring. Option C, administer diuretics as ordered. Option D, teach the client to restrict the fluid intake. Option E, promote a high protein diet. What could be the correct answer? Actually the patient is having what is that? Heart failure. So என்ன advice பண்ணோம் அப்படின்னு பார்த்தீங்கன்னா heart failureக்கு excess of fluid இருக்கும். So அதனால நம்ம என்னன்னா you have to give limited fluid intake. So that is why option A will be the correct answer. Fifth question, a nurse is caring for a client with a diagnosis of chronic obstructive pulmonary disease. Which of the following intervention is most important? Option A, administer bronchodilator as prescribed. Option B, encourage high calorie diet. Option C, teach pursed lip breathing techniques. Option D, monitor oxygen saturation level. What could be the very important it is? Actually the patient is having COPD. So மெயினாக என்ன பண்ணும் அப்படின்னா நிறைய வந்து கன்சல்ட் நிறைய சளி இருக்கும். ஸோ அதனால் what you have to administer bronchodilator. So that is why option A will be the correct answer. Next question, a nurse is preparing to administer new medication to a client. The client report previous allergic reaction to a similar medication. Which of the following action should the nurse should take? Option A, administer the medication, observe the reaction. Option B, contact the healthcare provider for on alternative medications. Option C, document the allergy and administer the medication. Option D, reassure the client with the medication to take the safe test. So what could be the correct answer it is? The correct answer is contact the healthcare provider for an alternative medications because the patient is having allergic to the particular medications it is. So that is why option B will be the correct answer. Move on to the next question. A nurse is educating a client diagnosed with type 2 diabetes about the importance of diet management. Which of the following statement by the client indicate an understanding of the teaching? Option A, I can eat whatever I want I long at medications. Option B, I should count carbohydrate balance by meals. It is okay to skip meals if I am not hungry. Option D, I can drink sugary beverages in moderation. What is the correct answer? Actually the patient is having type 2 diabetes. So what you have to tell the patients? I should count carbohydrate and balance by meals. அதாவது லிமிட்டடாக வந்து கார்போஹைட்ரேட் உள்ள திங்ஸ் இன் வாட் எவர் இட் இஸ் ஆல் கார்போஹைட்ரேட் சுகர் டயட் வந்து கம்மியாக இருக்கணும் அப்படின்னு சொல்லிட்டு யூ ஹவ் டு கிவ் த அட்வைஸ். தட்ஸ் வை ஆப்ஷன் பி வில் பி த கரெக்ட் ஆன்சர். A nurse is caring for a client receiving chemotherapy. Which of the following jobs should the nurse should monitor closely? It is option A, WBC. Option B, hemoglobin level. Option C, platelet count. Option D, serum electrolytes. Option E, liver function test. What could be the correct answer? Yeah, can you guess it that if the patient is having chemotherapy, you should monitor the WBC because it is going to be decrease the cell destruction. It is going to be taken place. Radiation கொடுக்கும்போது cell destruction நடக்கும். So that is why you should monitor the WBC count. Next question, a nurse is providing discharge instruction for a client after laparoscopic chemotherapy. Which of the following instructions should be the statement it is going to give the teaching it is? Option A, I can lift heavy object as soon as I feel able. Option B, I should report any sign of infection at the sensation site. Option C, I will follow a low fat diet. I can return to my normal activities in a week it is. So what could be the correct answer? There's a question here. The patient is undergone laparoscopy surgery. So that is why what should you advise? You should not lift the heavy object it is. So that is why option A will be the correct answer. Next question. A nurse is assessing a client with a history of hypothyroidism. Which of the following symptoms should the nurse expect it as? Option A, fatigue. Option B, cold intolerance. Option C, weight loss. Option D, constipation. Option E, dry skin it is. What should you have to be monitored? The correct answer is option A it is. Okay, next question. A nurse is caring for a client diagnosed with pancreatitis. Which of the following should be the priority? Option A, administer pain medication as prescribed. Option B, monitor vital signs closely. Option C, provide low fat diet. Option D, encourage fluid intake. What would be the correct answer? What should you follow? If the patient is having pancreatitis, you must be administered pain eaters. So that is why you have to administer the pain medication. So option A will be the correct answer. Next question. A nurse is teaching a client with chronic kidney disease about dietary instructions. Following food should be, the nurse should recommend a limiting. You should be tell that which food should not take it as limited only. Option A, apple. Option B, banana. Option C, chicken. Option D, potato. Option E, spinach. So what could be the correct answer? Which should you have to take? Because if the patient is having kidney failure, so automatically which is going to be lost? That is a potassium is going to be described. So that is why you have to tell the patient should not take. It is a limited intake of banana should be advised it is. So that's why option B will be the correct answer. Next question. A nurse is caring for a client who has undergone below knee amputation. Which of the following intervention is most important immediate post-operative period? Option A, assess phantom limb pain. Option B, monitor for sign of infections. Option C, maintain proper position for the residual limb fitters. And option D, encourage the client to verbalize feelings about the surgery it is. So what could be the correct answer for the knee amputation it is? Yeah, you have to be monitor the residual limb fitters. So that's why option C will be the correct answer. Next question. A nurse is providing care for a client diagnosed with tuberculosis. Which of the following intervention is most important? Option A, encourage the client to take medication as prescribed. Option B, teach the client about airborne precautions. Option C, monitor the client of signs and symptoms of respiratory distress. Option D, provide adequate nutrition. What would be the correct answer? Next question. A nurse is preparing to administer blood transfusion to a client. Which of the monitoring action should be nurse should take first? Option A, obtain vital signs, ensure the client identity, prime the IV line normal saline, assess the client blood type and cross match. What should be the first precaution you must be monitored? Yeah, what is the correct answer? First, நீங்கள் வந்து பேஷண்ட்ஸ் ஐடென்டிஃபிகேஷன் இஸ் வெரி எசென்ஷியல். ஸோ தட் இஸ் ஆப்ஷன் பி வில் பி த கரெக்ட் ஆன்சர். மாற்றி கொடுத்துடக்கூடாது. Next question. A nurse is assessing the client with a diagnosis of hyperlipidemia. So which of the following should be the nurse should expect to see? Option A, xanthomas. Option B, high density lipoprotein and less than it is greater than 60 mg per deciliter. Option C, low density lipoprotein less than it is 130 and also history of hypertension and elevated triglycerides. So what would be the correct answer here? Option A, xanthomas will be the correct answer. Okay, move on to the another question. A nurse is caring for a client who is post-operative after a total knee replacement. Following assessment should the nurse should perform it as first. First, option A, it is a pain level. And option B, check the surgical dressing. Option C, monitor range of motion. Option D, evaluate the client ability to bear weight it is. What should be you have to monitor post-operatively? That is you have to check the dressing. Any oozing or bleeding will be there. So you must be monitor the oozing and dressing it is. So that's why option B will be the correct answer. A nurse is educating a client with the asthma about the use of rescue inhaler which of the following indications need for the further teaching. Option E, I can use this inhaler whenever I feel short of breath. I should carry my inhaler with me at times. Option C, that is inhaler daily used to control asthma. I should take the inhaler before use it. What should be the correct answer here? This inhaler is for daily use to control my asthma. So that is why option C will be the correct answer. Next question. A nurse is caring for a client with a diagnosis of renal failure. Which of the following finding would the nurse would expect it as? Option A, BUN, that is bun level. Option B, increased creatinine. Option C, decreased calcium. Option D, decreased hemoglobin. Option E, increased potassium. What could be the correct answer here? If it is renal failure, what should monitor you? How to be do the bun level, that is blood urea nitrogen it is. The nurse is assessing the client with chronic heart failure. Which of the following symptoms should the nurse should expect to find it as? Option A, dyspnea or exertion. Option B, peripheral edema. Option C, bradycardia. Option D, productive cough with prothesvotum. Option E, rapid weight gain. What would be the correct answer? That is, you should be monitored. That is the heart failure, that is breathing difficulty. So option A will be the correct answer. Next question. Your nurse is caring for a client diagnosed with a deep vein thrombosis. What should be following the action should the nurse should take first? Option A, apply warm compression to the affected area. Option B, elevate the affected leg. Option C, administered anticoagulant therapy as ordered. Option D, assess the affected limb with swelling and tenderness. ஸோ இப்போ த பேஷண்ட் இஸ் ஹேவிங் டிவிடி டீப் வெயின் த்ராம்போசிஸ் இருந்தால் என்ன அசஸ் பண்ணுவீங்க அப்படின்னு சொல்லி கேட்டிருக்காங்க. ஸோ வாட் இஸ் அ கரெக்ட் ஆன்சர் அப்படின்னு பார்த்தீங்கன்னா அசஸ் த அஃபெக்டட் லிம் ஃபார் ஸ்வெல்லிங் அண்ட் டெண்டர்னஸ். ஸோ தட் வில் பி த கரெக்ட் ஆன்சர். ஓகே ஃபைன். நெக்ஸ்ட் மூவ் ஆன் டு த another question. A nurse is teaching a client about the prescribed use of transdermal nicotine patch. Which statement by the client indicate a need for further teaching it is? அதாவது டிரான்ஸ்டெர்மல் நிக்கோட்டின் பேட்ச் வைக்கிறாங்க இல்லையா, பேட்ச் வச்சுருக்காங்க. ஸோ அந்த பேஷண்ட்டுக்கு என்ன யூ ஹாவ் டு பி கிவ் ஃபர்தர் டீச்சிங் என்ன? ஸோ ஆப்ஷன் ஏ, ஐ கேன் ஸ்மோக் வைல் யூஸிங் எ பேட்ச். ஆப்ஷன் பி, ஐ ஷுட் அப்ளை த பேட்ச் டு எ க்ளீன் ட்ரை ஏரியா ஆஃப் மை ஸ்கின். Option C, I will change the badge daily. Option D, I need to remove the badge before taking a shower it is. So what could be the correct answer here? Yeah, first one. I can smoke while using the patch. That will be how to tell the patient should not smoke like that. So that is a correct answer here. A nurse is assessing a client with a chronic obstructive pulmonary disease. The following findings should the nurse should expect. Option A, prolonged expiratory phase. Option B, use of accessory muscle for breathing. Option C, decreased breath sound. Option D, cough and sputum production. Option E, cyanosis. So what would be the correct answer here? சிவப்படி பேஷண்ட் வந்து நிறைய அப்ஸ்ட்ரக்ஷன், அதாவது சளி இருக்கிறனால நெஞ்சு அடைச்சிருக்கும். ஸோ அதனால் அவங்களால மூச்சு விட முடியாது. ஸோ அதனால் அவங்க வந்து அக்சசரி மசில்ஸ், சைடு மசில்ஸ் எல்லாமே தே வில் யூஸ் இட். ஸோ தட் இஸ் வை ஆப்ஷன் பி வில் பி த கரெக்ட் ஆன்சர். Next question. A nurse is caring for a client who is experiencing a severe allergic reaction. So which of the following medication should the nurse should be prepared for administer? அதாவது அலர்ஜிக் ரியாக்ஷன் இருந்தால் என்ன ட்ரக்கு கொடுப்போம் அப்படின்னு சொல்லி கேட்டிருக்காங்க. ஆப்ஷன் ஏ, டைஃபென்ட்ரமின். ஆப்ஷன் பி, எபினெஃப்ரின். Option C, prednisolone. Option D, loratadine. So which drug you will be administered when the person is having allergic reaction? ஸோ யூஸ்வலாக வந்து நம்ம வந்து அவில் கொடுக்கலாம், அப்படி இல்லை அப்படின்னா அட்ரினலின் கொடுக்கலாம். ஸோ எபினெஃப்ரின் we are going to administer. ஸோ ஆப்ஷன் பி will be the correct answer. Next question. A nurse is teaching a client with diabetes mellitus about food care. So which statement by the client indicate need for further teaching? Option A, I should inspect my feet daily for any cuts or sore. Option B, I can go barefoot at home as long as I'm careful. Option C, I should wear well-fitting shoe to avoid blisters. Option D, I need to keep my feet clean and dry. So what could be the correct answer if you are going by this diabetes mellitus patient? என்ன டீச்சிங் கொடுப்பீங்க அப்படின்னா, அதாவது காலில் வந்து செருப்பு இல்லாமல் போனால் you have to be very careful. So that is why I can go barefoot at home as long as I am careful it is. So option B will be the correct answer. அதுதான் மெயின் டீச்சிங் you have to be advised. Next question. A nurse is assessing a client who has just received a diagnosis of cancer. So which of the following emotional response is most common during the initial stages of adjustment to this diagnosis? Option A, denial. Option B, anchored. Option C, bargaining. Option D, acceptance. Actually வந்து the patient is having cancer. ஸோ அப்படி இருக்கும்போது emotional response, what is the stage of adjustment அப்படின்னு சொல்லி கேட்டிருக்காங்க. ஸோ கரெக்ட் ஆன்சர் என்ன அப்படின்னு பார்த்தீங்கன்னா denial. It is a correct answer. Next question. A nurse is caring for a client with a diagnosis of bipolar disorder who is experiencing a manic episode. So which of the following intervention is most appropriate? Option A, encourage the client to socialize with peers. Option B, set limits on the client's behavior. Option C, provide stimulation to reduce hyperactivity. Option D, allow the client to make decision independently. So what could be the correct answer here? So that is when you are going to take a bipolar disorder, the patient is having bipolar disorder, அப்போ என்ன நீங்கள் வந்து you have to be do அப்படின்னா கரெக்ட் ஆன்சர் வந்து கிளைண்ட்டோட பிஹேவியர் வந்து you must be limited. So that's why option B will be the correct answer. Next question. Your nurse is preparing to administer a medication that requires monitoring the client blood pressure before administration. Which medication is most likely to require this assessment? Option A brucemide, option B metoprolol, option C digoxin, option D amoxicillin. Actually question enna before administering blood pressure medication what should you further? The correct answer is metoprolol. Next question. A nurse is caring for a client diagnosed with pneumonia. Which of the following intervention should the nurse implement to promote effective airway clearance? Option A encourage the client to cough effectively. Option B provide humidify oxygen. Option C position the client in supine position. Option D instruct the client to take deep breath. Option E administer bronchodilator as prescribed it is. So what could be the correct answer? The patient is having pneumonia, so you have to tell the patient to encourage to cough it is. So that is very essential. So that is why of A is the correct answer. Next question. Your nurse is caring for a client diagnosed with heart failure who has been prescribed digoxin. Which of the following assessment should the nurse perform to prior to administration? That is, check the client's blood glucose level. Option B, assess the client potassium level. Option C, monitor the client temperature. Option D, evaluate the client renal function. What could be the correct answer here? So when your patient is having digoxin, you must be monitor the potassium. That is why option B will be the correct answer. Next question. A nurse is assessing a client who has been diagnosed with major depressive disorder. Which of the following findings would the nurse to expect? Option A, increased energy level. Option B, anhedonia. Option C, insomnia. Option D, difficulty in concentration. Option E, weight loss or gain it is. So what could be the correct answer here? The patient is having major depressive disorder. So what is going to be like it is? That is called it as anhedonia. That is why option B will be the correct answer. Next question. A nurse is caring for a client undergoing chemotherapy. Which of the following nursing intervention is essential in preventing infection? Option A, encourage the client to eat high fiber diet. Option B, teach the client about signs and symptoms of infection. Option C, administer immunization as prescribed. Limit visitor to the client. So what could be the correct answer here? Yeah, you must be monitor the signs and symptoms of infection it is. So that is why option B will be the correct answer. Next question. A nurse is providing discharge instruction for a client after a myocardial infarction. So which statement indicate the client understand the teaching? Option A, I can resume my normal activities immediately. Option B, I will follow up with my doctor for my cardiac rehabilitation program. Option C, I will take my medications only when I feel chest pain. Option D, I should avoid the physical activity for 6 months. So what could be the correct answer? If the patient is having myocardial infarction, what should you have to do this? You have to tell, you have to visit the doctor by cardiac rehabilitation program. So option B will be the correct answer. Next question. A nurse is assessing a client with a cirrhosis of liver. So which of the following findings should be assessed? Okay, except. So option A, jaundice. Option B, ascites. Option C, hypotension. Option D, increased albumin level. Option E, portal hypertension. So what do you have to accept for that? It is jaundice. Next question. A nurse is caring for a client receiving hemodialysis. So which of the following assessments should the nurse perform immediately after the treatment? Option E, measure blood glucose level. Option B, assess the hypotension. Option C, check the assess site for bleeding. Option D, evaluate the client weight. What should be the correct answer? What should monitor? You have to monitor the hypertension. A nurse is teaching a client about dietary modifications for management of hypertension. So what is the dietary choice for indication of further education? Option E, consume whole grain. Option B, increasing fruit and vegetables intake. Option C, choosing high fat dairy product. Option D, reducing sodium intake. So what could be the correct answer here? Yeah, you have to tell the patient you have to take the fat dairy product. That will be option C will be the correct answer. Next question. A nurse is preparing to administer blood transfusion. Which of the following priority should be begin the transfusion? Option E, obtain a signed consent form. Option B, verify the blood product with another nurse. Option C, pre-medicate the client with acetaminophen. Option D, assess the client for vital signs it is. So what you have to monitor? What is the correct answer here? That is option B, verify the blood product with the another nurse. So option B will be the correct answer. A nurse is caring for a client who has undergone cholecystectomy. So which of the following finding would a nurse should be prepared for the complications? So option A, mild abdominal pain. Option B, fever. Option C, jaundice. Option D, cleared urine output. So what you have to be find out from the whole cystectomy patients. So what is the correct answer here? That is also post-operative. So that correct answer is jaundice. A nurse is caring for the client with a tracheostomy. So which of the following action is highest priority for maintaining airway patency? Option A, suction the tracheostomy tube as needed. Option B, change the tracheostomy ties daily. Option C, codify the inspired air. Option D, assess the stoma for irritation it is. So what you have to do this, if the patient is having tracheostomy, you must be do this daily suctioning out. That is why option A will be the correct answer. Move on to the next. So a nurse is caring for the client with hypothyroidism. So which of the following finding would the nurse to expect to assess? Option A, weight gain. Option B, increased heart rate. Option C, cold intolerance. Option D, dry skin. Option E, constipation. So what would be the correct answer? If the patient is having hypothyroidism, what is the main it is that will be accepted they are asking? So that is weight gain. So option A will be the correct answer. Next question. A nurse is teaching a client about the side effect of prednisone. So which of the following statement by the client indicate need for further teaching? Option A, I should watch the signs and symptoms of these medications. And also I may experience increased appetite and weight gain. I can stop taking this medication when I feel better. I need to monitor my blood sugar level. So what would be the correct answer? I can stop medications when I feel better. That will be the correct answer. Next question. A nurse is caring for a client with a history of asthma who is experiencing an acute asthma attack. So which of the following interventions should the nurse implement first? So option A, administer bronchodilator. Option B, encourage the client to purse lip breathing. Option C, client oxygen saturation. Option D, position the client for upright position. So what would be the correct answer? You must be administered a bronchodilator if the patient is having asthma for the consultation. So you have to be do this. Asthma patient is having more, it is solidation. So that is why you have to tell the patient to take the drug regularly, and also expiration is very important for that. So that is why option A will be the correct answer. Next question. A nurse is monitoring the client who receiving blood transfusion. So which of the following findings would indicate potential transfusion reaction? Option A, fever and still and blank pain. Option C, rash. Option D, increased heart rate. Option E, hypotension. So what would be the correct answer if the patient is having blood transfusion reaction? So that is fever and chills also. That's why option A will be the correct answer. Next question. A nurse is caring for the client with chronic kidney disease who is in a low protein diet. So which of the following food should be the nurse encourage the client to eat? Option A, egg. Option B, chicken. Option B, it is spinach, and also the apple. So what is the correct answer? Because the patient is having CKD. So that means you must be administer which one it is. Apple should be advised. So that is your option D will be the correct answer. Next question. A nurse is caring for the client who is receiving total parenteral nutrition. So which of the following nursing action is highest priority? Option A, monitor the client daily weight. Option B, assess the client glucose level. Option C, change the TPN solution every 24 hours. Option D, check the transfusion site for sign of infections it is. Actually, the patient is underwent it is TPN, so you tell that it is, you must be monitored, and also 24 hours chart. Along with this, you have to change the solutions and every day it is. So that is why option C will be the correct answer. Next question. A nurse is assessing a client who has been diagnosed with pneumonia. So which of the following assessment finding would the nurse expect to find it is? Option A, crackles in the lungs. Option B, productive cough. Option C, tachypnea. Option D, bradycardia. Option E, fever it is. So what would be the correct answer? The patient is having pneumonia, you will get a crackle sound. So that is why option A will be the correct answer. Move on to the next question. A nurse is caring for a client with a spinal cord injury at the C4 level. So which of the following findings should the nurse expect? Option A, quadriplegia. Option B, ability to walk with assistant. Option C, loss of bladder and blood control. And also option D, full use of upper extremity. So what would be the correct answer here? So answer is quadriplegia. Move on to the next question. A nurse is teaching a client about the salmeterol with asthma patients. So which of the following statement by the client indicate understanding of the medication? Option A, I can use these medications during an asthma attack. Option B, this medication is long-acting bronchodilator. Option C, I use this medication only when I feel symptoms. I need to take the medication before the correct answer is this medication is long-acting bronchodilator. So option B will be the correct answer. Next question. A nurse is preparing for administration of warfarin for a client. Which of the following laboratory tests would the nurse review for before admin? So what is the correct answer here? Option A, prothrombin time and international normalized ratio, and also option B, activated partial prothromboplastin time. Option C, complete blood count. Option D, blood urea nitrogen. So what could be the correct answer? If the patient is having warfarin, what you have to check? You have to check the prothrombin dynamiters because it's going to make a bleeding. So that is why you have to check it for the prothrombin time. So the option A will be the correct answer. I think you have understand all the question and answer. If you want anybody question paper, please contact us. If you like this video, please like and subscribe channel. This will fish Meena. Thank you for watching.